everyone. We begin the readout tonight with a momentous time for our country. 1 hour from now, President Biden will deliver his first primetime address to the American people. We've just learned that he will flag two very important upcoming dates. By May 1st, less than 2 months from now, he's directing all states and territories to make all adults eligible for the vaccine. You'll also want to mark July 4th on your calendar. Biden is expected to announce tonight that Americans should be able to gather in small groups by then. Two dates to look forward to, as today marks 1 year since the World Health Organization officially declared the coronavirus to be a pandemic. It's a sobering milestone, with more than 500,000 American lives lost between that declaration and tonight. And even with Biden's hopeful announcement, tonight is one of those occasions when it is important to step back and remember how we got here. Starting 1 year ago today, March 11th, 2020, when the world stood still.
All right, so just moments ago on Capitol Hill, government health officials testified on the government's response to coronavirus. And this statement from one of the nation's top medical experts was not reassuring.
We will see more cases, and things will get worse than they are right now.
There are now more than 1,000 cases reported in this country, and so far, 30 deaths.
The World Health Organization has officially declared the coronavirus to be a global pandemic.
Cases spiking.
More market stress, more liquidity stress. Be careful out there is what I tell people.
The market tumbling.
Dow is down more than 5% today, officially entering a bear market.
Fear on Wall Street and Main Street.
It's the Dow dropping more than 1,400 points, its second biggest point loss ever.
Late this afternoon, the NCAA announced that it will hold March Madness without rowdy fans.
This is an NBC News special report.
We're interrupting our regular programming to bring you remarks from President Trump on the coronavirus outbreak, now a pandemic.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days.
Moments ago, Rudy Gobert of the Utah Jazz testing positive for COVID-19, the coronavirus. As a result, the NBA will suspend play. The league will go on a hiatus following the conclusion of action tonight.
Academy Award-winning actor Tom Hanks and his wife, the actress Rita Wilson, have announced that they have both tested positive for coronavirus.
That's a real face now. That Tom and Rita Hanks is a real thing, a real fact for Americans to consider. If it can happen to them, even though they are in Australia, it can absolutely happen to anyone. I think that's a reality now through Tom Hanks that a lot of people might not have had.
That day changed everything. It all just happened at once. Those of us who are privileged stopped going into the office, unlike the many essential workers who didn't have that option. We started talking about flattening the curve and social distancing. We were told we had 15 days to stay at home and slow the spread, days that stretched into months. Schools went virtual, and many students still haven't gone back. Stay-at-home orders that started in only a few states quickly became the norm across the country. The president at that time was still downplaying the virus and giving himself an A+ for his response. We now know he was very much aware of how bad the situation really was. And we were told by experts that we didn't need to wear masks, something almost unfathomable to think about now. As healthcare workers struggled to obtain the equipment they needed and to deal with the mass casualties they were experiencing. And while there hasn't been anything quite like those initial few weeks, for many of us, this pandemic life of social distancing and mask wearing has become our new normal. 1 year later, we're still in it, with more than 29 million people having been infected and more than 530,000 dead. Let's turn now to critical care pulmonologist Dr. Vin Gupta and Jason Johnson, professor of politics and journalism at Morgan State University. Two of the people we most wanted to talk to tonight, that I most wanted to talk to tonight. So thank you both for making time. You know, Dr. Gupta, let me play for you what Dr. Fauci actually said today. He was on the Today Show, and he talked about probably the most dangerous thing that happened over the last year.
We had such divisiveness in our country that even simple common sense public health measures took on a political connotation. when people, you know, if you wanted to wear a mask, you were on this side. If you wanted to stay in and avoid congregate settings, you were on this side. It wasn't a pure public health approach. Mixed messages were coming from Washington, that's for sure.
You know, Dr. Gupta, I mean, it's fair to say, look, I remember the politicization even around Ebola, you know, when President Obama was president and Republicans tried to somehow find a way to use that against him politically. But Ebola killed 3 people in the United States. It killed a lot more on the African continent. We're talking about something that wound up killing 500,000 people plus. Have you ever experienced anything in the public health sector like this, where something like a virus that doesn't care who anyone is becomes a political matter, and that leads to death?
You know, Joy, I haven't. It's good to see you, by the way. Good evening. What I'll say is there's a few things here. There's a deep irony, number one, that this took the journey it took, that everything got politicized. Because if we had just done, you know, unfortunately, former President Trump knew this was an airborne virus on, I believe it was, February 7th. If we had put into place the measures that anybody otherwise would on learning that knowledge, then if there was a tactical shutdown at that point, if the strategic national stockpile had been replenished, if we knew what we knew now about this virus, if those had actually been, if that information was used to inform actual public policy, this would have been less of an issue. We probably, some estimates say, we would have saved 70% of the lives now lost. Imagine that, Joy. I mean, imagine that. So number one, it's ironic. Yeah, well, it's ironic because it got politicized, and it ended up obviously becoming a much bigger problem for the former president than it needed to be. And number two, I'll quickly say to your question: is there precedence for this? You know, the biggest precedence I would say for politics and being injected into public health is, for example, what big lobbies do when they want to get their way. The smoking lobby, for example. Smoking still is the biggest killer of people worldwide, in part because the smoking lobby, the tobacco lobby, is still quite powerful and continues to deceive. That's probably the biggest, the most pertinent analogy here, even though it's imperfect.
Yeah, it is a good analogy. And, you know, speaking of it becoming a big problem for the former president, Jason Johnson, usually the easiest things for a president to run for re-election are on war and tax cuts. You know, those two things are usually surefire winners politically. Donald Trump was sitting on this crisis in which he could have shown himself to be a leader. This was breaking around the time of impeachment. He needed another story. So he had an opportunity to have another story. I just want to play, this is a little long, so just have patience with us. And we normally don't like to really play him, to be honest with you. But we're going to play him tonight. And this was Donald Trump's incoherent, speaking of mixed messages, message on COVID.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. The risk to the American people remains very low. Because, you know, this virus is going to disappear. It's going to disappear. One day, it's like a miracle. It will disappear. This is a flu. This is like a flu. It will go away. You know it is going away. As an example, on the masks, if people wanted to wear them, they can. I just don't want to wear one myself. It's a recommendation. This is going to go away without a vaccine. Hydroxychloroquine. You're not going to die from this pill. And then I see the disinfectant. Is there a way we can do something like that? By injection inside or almost a cleaning. You know, our doctors get more money if somebody dies from COVID. You know that, right? The minimum number was 100,000 lives, and I think we'll be substantially under that number.
And just one more, if we can stand, if y'all can stand and bear with me for like 17 more seconds. Here he is talking to Bob Woodward. He called Bob Woodward and said this to him.
It's a very tricky situation. It goes through air, Bob. That's always tougher than the touch. You just breathe the air, and that's how it's passed. It's also more deadly than your strenuous flus.
I mean, just as a political science matter, Jason, is this the biggest blunder, public communications blunder by a president? I guess since Woodrow Wilson basically did the same thing with the so-called Spanish flu.
Yeah, and I've written a lot about the similarities between Trump and Wilson. They were both white supremacists. One just happens to be a lot smarter. That was Wilson. The political consequences of this have been horrific. First off, 500,000 people are dead. Most of us have never experienced that in our lifetimes. It's bigger than multiple wars combined. And it's resulted in such a breakdown of so many fundamental things in the American economy and healthcare. It has left us a broken and less functional country. And as of right now, we still have so many different states that are refusing to follow the basic rules because of what Trump did last year. You have Florida that's fudging the numbers because they won't listen to the CDC, other places that are opening themselves up. But I would say, Joy, that the one political consequence that can't be avoided in all of this is that COVID is the reason that Donald Trump lost. Had he even remotely cared about handling this crisis last year, had he not tried to pick and choose and assumed that it was only going to be a blue state problem, had he not stood against masks and simply said, hey, do what you want, he would probably still be president of the United States today. It was Donald Trump's failure to address this horrible human rights, human health crisis that led to a lot of people saying we can't have this anymore and kicking him out of office. Wasn't the racism, wasn't the bigotry, wasn't the corruption, wasn't the cheating, it was COVID.
Yeah, that is hard to argue against. So let's turn the page a little bit. Let's turn the page. So, Dr. Gupta, I will admit on TV that you are the person who single-handedly made me get over my nervousness about the vaccines and become determined to get vaccinated and to promote and push to everybody get vaccinated. I'm not yet, haven't gotten, my group hasn't come through yet, but I'm determined to do it now. And because of you, I'm determined to get whichever one I can. I don't have like the J&J issues and everything. But let's talk about these deadlines that President Biden has put up. May 1st, everyone being able to get the vaccine. Is that the kind of good, positive messaging that helps, or is that going to? Are you worried that might cause just a rush on the vaccines on May 1st, starting on May 1st?
I think it's overwhelmingly positive because people are really clamoring to get access because they know now, because they know CDC guidance is phasing in normalcy if you're vaccinated, right? They started small. They're going to go bigger as more people get vaccinated. But people are recognizing, connecting the dots. If I get vaccinated, that means I can plan summer vacation. That means holidays are going to be normal again. So it's good that they're moving up the time schedule. And I think, we have our muscle memory now in place, Joy. We know how to do this in more zip codes across the country, these mass vac sites. So I think, it's a wonderful news for all of us. And I'm really glad. Thank you. I'll just quickly say thank you for bringing up the Johnson & Johnson vaccine. Too many people out there to think it's inferior. It's not. You only get a vaccine to keep yourself out of the hospital. It's 100% effective at keeping you out of the hospital.
Oh, I'll take any of them. Trust me. But real quick before I let you go, am I crazy to still be very nervous? Even if I finally get it, I get my J&J or whatever, I'd still be a little nervous, honestly, to do anything on July 4th and go in, do anything indoors in a gym or anything. I'd still be scared. Am I right to still be nervous after vaccination?
So you should be reassured that you're not going to end up in the hospital. I think it's appropriate that we're going to still have some residual trauma, if you will, from what's just happened the last 16 months. So yes, I do think people may continue to mask and distance, but caution for the rest of this year. Frankly, I wouldn't be surprised if that's how most people decide to live their life, cautiously. And so, no, I don't think that's wrong at all.
Yeah. Yeah, I'm keeping my mask, and I've made them fashion, so I will be wearing my mask for the time being in the near future. Dr. Vin Gupta, thank you, my counselor, who doesn't even know that he's my counselor on COVID things, and Jason Johnson. Thank you very much, my friend.